Hey there, I'm Isaac, and I'm here to provide a briefing on Indigenous Services Canada, a federal government department dedicated to improving the quality of life for Indigenous peoples in Canada. Over the next few minutes, I will outline what ISC is responsible for, the services it provides, the challenges it faces in service delivery, and how it is working to overcome these challenges. So, what is Indigenous Services Canada responsible for? Indigenous Services Canada is a federal department tasked with ensuring First Nations, Inuit, and Métis people make sure that they receive essential services that support their well-being and self-determination. ISC's mission is to close the socioeconomic gaps between Indigenous and non-Indigenous Canadians by improving access to education, healthcare, clean water, governance support, and other vital services. In addition to service delivery, ISC works closely with Indigenous communities to support self-governance and promote Indigenous-led decision-making. This is a crucial step toward reconciliation and long-term community sustainability. So, what does ISC provide to Canadians? What services does ISC provide to Canadians? Well, ISC is responsible for a wide range of services that directly impact the lives of Indigenous peoples. These services include Indian status registration, education programs and funding, healthcare services, clean drinking water and infrastructure, governance and self-determination support. Just to kind of give an overview of each of these, Indian status registration. So the ISC manages the Indian status application process under the Indian Act, ensuring that eligible individuals can access benefits such as healthcare and education. It also provides resources for individuals researching their First Nations ancestry and offers assistance in appealing status application decisions. Education programs and funding. Well, the ISC funds elementary, secondary, and post-secondary education for First Nations students. This includes initiatives such as the National School Food Program, funding for special needs students, and financial assistance for post-secondary education. The department also supports Indigenous culture education centers and adult education programs. Healthcare services. The ISC provides healthcare funding through programs like the Non-Insured Health Benefits, or the NIHB program, which covers medical services such as prescription drugs, dental care, vision care, and mental health support for eligible First Nations and Inuit individuals. The department also implements anti-Indigenous racism training for healthcare providers to ensure culturally safe care. Clean drinking water and infrastructure. So one of ISC's most critical responsibilities is ensuring access to clean drinking water in First Nations communities. The department works on eliminating long-term drinking water advisories, investing in water infrastructure, and training Indigenous water system operators through the Circuit Rider Training Program. Lastly, governance and self-determination support. So the ISC collaborates with Indigenous communities to develop self-governance agreements, which allow First Nations to manage their own governance, education, and economic development. Now, by funding policy development and leadership training, the ISC supports Indigenous nations in taking control of their futures. So what challenges is the ISC facing with service delivery? Now, despite its efforts, the ISC faces several significant challenges in service delivery. I'm just going to name kind of the few that I've come up with. So the number one would be historical and systemic barriers, which we'll get to in a minute. The second would be delays and bureaucratic complexity. The third would be healthcare disparities and racism. The fourth would be clean water crisis. And the final one would be education and economic gaps. So firstly, historical and systemic barriers include many Indigenous communities continue to experience the long-term effects of colonization, systemic racism, and historical policies that have limited their access to education, healthcare, and economic opportunities. These barriers make it very difficult for the ISC to deliver services effectively. Number two, delays and bureaucratic complexity. The process of applying for Indian status, funding, and benefits is often very slow and complex, leading to frustration among Indigenous individuals and communities. Many applications face long processing times due to bureaucratic inefficiencies. Healthcare disparities and racism. Indigenous peoples experience higher rates of chronic illness, mental health challenges, and barriers to healthcare access compared to non-Indigenous Canadians. Additionally, systemic racism in the healthcare system has resulted in negative experiences and distrust among Indigenous patients. Clean water crisis. Access to clean drinking water remains a major issue, with some Indigenous communities still experiencing long-term drinking water advisories. The slow pace of infrastructure development and maintenance continues to be a challenge. Lastly, education and economic gaps. Indigenous students face lower graduation rates and fewer opportunities compared to non-Indigenous students. Many communities lack adequate school infrastructure, which limits access to quality education. Now, how is the ISC working to overcome these challenges? Well, the ISC is actively implementing policy changes, funding increases, and community-led initiatives to address all of the challenges listed above. Some of its key solutions include simplifying and accelerating services, which the department is working to streamline the application process for Indian status and other programs by improving digital access, hiring more staff, and creating clearer guidelines for applicants to streamline the process, make it easier. Investing in healthcare and anti-racism training. So the ISC is investing in Indigenous-led healthcare initiative and expanding the non-insured health benefits program mentioned earlier to provide better medical care for Indigenous peoples. Anti-racism training is being introduced across all healthcare systems to improve the experience for the patient. Increasing funding for clean water structure, as mentioned above. The government has committed to eliminating all long-term drinking water advisories and investing in new water treatment facilities, training Indigenous water system operators, and improving maintenance protocols. ISC also works with First Nations leaders to develop long-term water management solutions. Strengthening Indigenous self-governance. ISC is supporting Indigenous-led government models that give First Nations communities greater control over their education, healthcare, and economic development. By expanding self-government agreements, ISC aims to empower Indigenous communities to make decisions that align with their cultural and economic needs. Lastly, enhancing education opportunities. The department is providing increased funding for First Nations students at all education levels. ISC's commitment to cultural educational centers and Indigenous language revitalization ensures that education is not only accessible, but also reflective of Indigenous traditions and identities. Finally, Indigenous Services Canada plays a critical role in improving the lives of First Nations, Inuit, and Métis peoples by providing education, healthcare, clean water, and governance support. However, historical injustices and systemic barriers continue to challenge service delivery. ISC is actively working to overcome these challenges through policy reform, funding increases, and Indigenous-led decision-making initiatives. While progress is being made, there is still much work to be done to ensure that Indigenous communities receive the services they need in a way that respects their autonomy, culture, and self-determination. The role of the public servants in ISC is vital to ensuring that these commitments are fulfilled and that Indigenous people in Canada can thrive. Thank you so much for your time, and this has been my presentation.